Nearly 2 million people in the U.S. have already gotten their first COVID shots, a glimmer of hope in a really dark month. December is now the deadliest month of the pandemic here in the U.S. Nearly 65,000 people have already died, and we still have 3 days to go. Dr. Fauci warning that January could be even worse.
We very well might see a post-seasonal, in the sense of Christmas, New Year's surge. And as I've described it, as a surge upon a surge.
NBC News senior medical correspondent Dr. Torres joining me now. Dr. Fauci saying there that he's expecting us to see a surge upon a surge, likely because of holiday travel and get-togethers. For people who did not follow CDC guidance, who traveled anyway, who got together in big groups anyway, what should they do when they are back home so that they don't spread this virus?
And Allison, what Dr. Fauci is saying is a surge upon a surge, meaning we're going to pile on to those cases that are already coming up after the Thanksgiving break. Other experts are saying January is going to be a nightmarish month because there's going to be so many COVID cases because of what we did over our holiday month here. And the thing of it is, you need to think about what you did during that holiday trip and who were you around, because like you and I have talked about, Allison, when you're around somebody, you're not just around them, you're around everybody they've been around for the past 2 weeks. And so think about how safe they were before they got to that gathering, and then how safe you were at the gathering itself. Did you social distance? Did you wash your hands? Were you outdoors or in a ventilated area? And if not, then when you get back home, you want to think about, do I need to quarantine myself? Your state might not say, might say that you have to anyway, and so you have to follow those state or local regulations. But also, if you weren't doing all the safe things you could have done while you were out there, think hard about quarantining yourself for 14 days when you get back, especially if you have relatives or people you're interacting with who are at high risk for complications from COVID, because we know 40% of cases can spread from people who don't even have symptoms. And last thing you want is to have a great holiday, but then bring COVID back with you, spread it to somebody else, and they run into problems because of that. So again, think about what you did on that trip, and if the things you did weren't constantly wearing masks, social distancing, ventilated areas, washing your hands, then you might want to think about quarantining yourself, Allison.
Dr. John, starting today, people flying to the U.S. from the U.K. need proof of a negative COVID test within 72 hours of their departure. This is all because of that new COVID strain in the U.K. Is that enough, or do you think we need to be doing more here?
Allison, I think to a certain extent, it's almost like closing the barn door after the horses got out. So a few horses might have gone out. You close the barn door, you save the horses that are there. But the ones that got out, they're already doing what they're doing out there, and you have to track them down. Same thing here. This virus has been observed since September. And so people are looking at the virus now. They know it's spread to other areas. We've seen incidences of it here in the U.S. as well, or at least we think we have. And so to a certain extent, testing people, yes, that's going to stop ones that are coming up from now on. But the ones that have already come across, that could be a big issue. So we need to make sure that we're finding out more about this virus, how well it really spreads, if it's any more dangerous than the other viruses, than the normal virus that we're talking about, and then go from there, Allison. So to a certain extent, again, it's almost like closing the barn door a bit too late.
Dr. John, the CDC says nearly 2 million Americans have been vaccinated so far. Operation Warp Speed had been projecting 20 million vaccinations by the end of this year. So we're just 10% of the way there, with only 3 days left in 2020. How big of a setback is this? And does this mean that our vaccination timeline in the months to come is just way off?
Allison, I think it's a little bit of a setback, and I think our timeline is off. I'm not sure just how much off it's going to be, because we're learning as time goes on how to give this vaccine. And I think the biggest thing they learned is that this vaccine is not like the flu vaccines we're used to giving out across the country every spring, every fall, winter time frame. That one you can give people. They have drive-by clinics. People come through and get shots within 2 or 3 minutes. They'll get their shot and move on to the next person. But this one's taking 15, 20, 30 minutes per person to give because of all the questions you have to answer, all the information you have to get, and then watching them afterwards takes a lot of time too. So the logistics are there to slow it down. On top of that, distribution has had a few hiccups. I think once we iron all that out, we'll start getting more up to speed on giving these vaccines. I don't think we'll get to the numbers that we thought we'd get to as early as we thought we'd get to those numbers, but I think over time we'll see it going faster and faster. Of course, getting that acceptance among people is going to be an issue as well. It's one thing getting healthcare workers who are constantly working with COVID patients to accept it. It's another getting people who have never been around somebody with COVID and don't even necessarily believe that it's that big of an issue to get the vaccine. But as you know, as we've talked about, we need a lot of people to get it.
In the global race between injections and infections, millions have now been vaccinated against the COVID virus. In China, where it first appeared, more than 20 vaccines are in production, several approved and now being sent abroad.
Big problem.
The governor of Brazil's most populous state says he'll try to force people to have one of the Chinese vaccines next month, in a country with the second highest death toll in the world after the US. Yet China hasn't finished trials for its key vaccines.
We haven't seen that yet.
But scientists also acknowledge the urgent demand.
There's no border to this pandemic, and there shouldn't be a border to the vaccine.
Russia's Sputnik vaccine is another shot in the dark. Its final clinical trial results still unpublished.
It doesn't mean that the vaccines are unsafe. And I would argue that to make that assumption is a terrible mistake.
But many Russians are skeptical.
I think it's dangerous.
I'm scared of this very much. And maybe I'll take it, yeah, why not?
Yet the European vaccine maker, AstraZeneca, has signed a deal with Russia to develop vaccines. The Pfizer vaccine, which needs ultra-cold storage, may never reach the poorest parts of the world. Many countries can't afford costly Western vaccines.
There is a need for the world to receive this vaccine. There should be access everywhere.
Which is why G20 leaders pledged last month to share vaccines with poorer nations.
The Chinese virus.
But vaccine nationalism won't end soon. Who was first? Whose is the best? Who's the most generous? The race is still on as the virus mutates and thousands die by the day. Never before has the whole world set out to vaccinate its population. But with rich countries making and buying up most of the vaccines, it could be years before millions in developing nations get one. And the problem for us? Well, no one is safe until we're all safe. Bill Neely, NBC News, London.
More than 1.2 million people traveled to the TSA. That's a record for air travel during this pandemic. Health officials warned that holiday travel would cause a COVID spike. So what's on the way? Joining me now, Dr. Ramesh Adalja, senior scholar at the Johns Hopkins University Center for Health Security. Dr. Adalja, it's so great to see you today. Millions of people clearly did not listen to the CDC's advice to stay home for the holidays. We already know that December is the deadliest month of this pandemic so far. Is there any way, anything we can do at this point to prevent January from being even worse, or is the damage already done here?
A lot of the damage is going to be done. We know that people traveled. We know that people had private gatherings, and many of them probably didn't follow all of the common sense recommendations that we've been stating. So I do think we're going to see some level of increase in cases, increase in hospitalizations, and increases in deaths after Christmas, just as we did after Thanksgiving. I think it's really inevitable when you look at how much community spread is going on, and I think it's going to be tough days for hospitals in the coming weeks.
The good thing is that we are at least heading into the new year with vaccines. Our healthcare workers, long-term care residents getting those shots as we speak. I know that you got the Pfizer vaccine already. Could you tell us about your experience with it?
Well, I got vaccinated a little over a week ago, and it was the Pfizer vaccine. It was a very good process. I had no side effects, and I'm scheduled to get my second dose in a couple of weeks. And I think that this is something that gives me a lot more confidence taking care of COVID patients. I'm speaking to you right now from a hospital, and there are COVID patients just outside that door. So this gives me a little bit better peace of mind that I'm protected from severe disease. And I really think that this is a triumph of science, and it will be the way that we put this public health emergency behind us.
So I have to ask, because a couple of doctors that we've had on have answered this question for us, several of them saying it didn't even hurt as much as the flu shot. How much did that shot hurt, and were you feeling it a little bit afterwards?
I actually had no side effects at all. I didn't even have arm soreness.
Wow.
And that's less than the influenza vaccine. So I likely will probably see some more side effects when I get the second dose, because there's already some immunity that's been generated. So that will boost that immunity. But the first vaccine was basically nothing.
That's fantastic to hear. Dr. Adalja, drug maker Novavax announcing that it is starting phase 3 trials in both the U.S. and Mexico. What should we know about this particular vaccine candidate?
Well, this is a vaccine candidate using recombinant technology, so it's even it's another example of high-tech ways of solving vaccination problems that really are only available to us in the last decade or so. So this is another vaccine that I think we'll eventually see come to fruition, and it will be something that will add to the capacity that we have, and it will be another option that people have. And eventually, I think we'll have a menu of COVID vaccines, and maybe eventually we'll have certain COVID vaccines are better in certain groups, the way we do with flu vaccines, and give some to elderly individuals and others to other risk groups. So I just think in general, all of these vaccines, letting them all bloom, is one of the best things that we're going to see kind of as a consequence of the COVID-19 pandemic, because it's going to change the way we respond to future infectious disease threats, that these vaccine technologies found a way to actually prove their worth.
Dr. Anthony Fauci originally said that around 70% of Americans need to get vaccinated for us to reach herd immunity. Now he's saying potentially 85%, comparing this to the measles shot, which needs 90% to stop an outbreak. Listen to this here.
Measles is the most transmissible infection you can imagine. So I would imagine that you would need something a little bit less than the 90%. That's where I got to the 85. But I think we all have to be honest and humble. Nobody really knows for sure. But I think 70 to 85% for herd immunity for COVID-19 is a reasonable estimate.
Dr. Dauja, why is it so difficult to nail down that number that we need to reach herd immunity? And do you agree with Dr. Fauci here? Do you think it might be on that higher end, say 80, 85%?
If you're talking about the population as a whole, to be able to keep this at bay, I do think you're looking at the 75, 85% range. However, we'll start to see benefits when we get our vulnerable populations vaccinated, because that's what's really clogging up hospitals. That's what's taking up ICU bed space. That's what we're worried about on a day-to-day basis. And that's also what's causing a lot of the deaths. So once we start to get those groups vaccinated, I do think we'll start to see a benefit. And you have to remember that when you look at herd immunity, it's a hard thing to calculate, because you have to understand whether or not the population is homogenous or heterogeneous. And we know that not everybody contributes to the spread of this virus, that maybe 20% of people are responsible for 80% of cases. So we may get to a benefit of herd immunity before we actually cross that threshold. But clearly this virus is more contagious than influenza, but it is less contagious than measles. So I do think that Dr. Fauci's calculation is correct.
Dr. Dauja, over the weekend, the CDC issued guidance for adults with underlying health conditions, including autoimmune diseases, saying that they can get vaccinated. What should our viewers know about that latest guidance?
Well, we know that people who have autoimmune diseases and other medical conditions are at the highest risk for needing hospitalization or dying from this. So in that situation, the risk of the vaccine is outweighed by the benefit. So I do recommend individuals with autoimmune diseases get this vaccine. And I think you'll start to see more data based on the clinical trials and the experience of those individuals getting vaccinated to give us more information about this group. But it is a group that we want to get vaccinated. We need to get our vulnerable populations vaccinated, because that's how we really disrupt the damage that this virus is causing to society.
How about the timeline for the vaccine? Operation Warp Speed, the federal government hoping that we would have some 20 million Americans vaccinated by the end of this year. It's now December 28th. It looks like only about 2 million vaccinations have happened so far. What does that mean for the timeline? Do you expect that the average person waiting to get a vaccine will now have to wait even longer because we're so far off track? Or is this just part of the process when you're rolling out something that you've never quite rolled out before?
I think it's part of the process. We know there's going to be hiccups and glitches. It's not going to go off completely exactly as we planned. That's what happens when you're doing a major public health endeavor. I do think, though, for the general public to get this vaccine, we're looking at late spring, summer. I think that timeline is achievable. It's in the realm of possibility. And you have to remember that we're getting better at this every day. Hospitals are increasing the rate of vaccination. It started out slower. It's getting faster and faster. So I do think we'll get to a point where we can likely get the population eligible to be vaccinated by the summer.
Dr. Dauja, I know I need to let you go, but one quick question before you do. New Year's coming up the end of this week. Your advice for folks for how to stay safe?
Just remember that the virus is going to be with you at your New Year's celebration. So that doesn't necessarily mean you have to lock yourself at home, but it does remember that you need to think about where you're going, who you're going there with, try to limit the number of people that are there, try to wear a face covering. If you can do things outdoors, if you can open a window, all of that is going to decrease the spread of this virus during New Year's celebration. I think that we know people are going to take these risks. I just want them to have the tools at hand to be able to lower that risk.